So a small introduction about Sir. Sir is an ophthalmic surgeon practicing at Tiruvanmiyur. He is visiting cataract surgeon at Dr. Mohan's Diabetes Center, Gopalapuram, Chennai. He has performed live cataract surgical demonstration in various opthal conferences as a skill transfer. He started his diet journey in 2017, reducing weight from 78 to 60 kg in 1 year. He is interested in various types of fasting, experimenting solely on himself. He started with 3 meals a day, then 2 meals, and then went to 1 meal a day. And வாட்டர் மட்டுமே குடிச்சிட்டு 12.5 days, அதாவது 303 மணி நேரம் வெறும் தண்ணி மட்டுமே குடிச்சிட்டு he has done fasting. And he started cycling to hospital from 2018. இந்த ஃபாஸ்டிங் பண்ணிட்டு இருக்கும் போதே 5 நாள் வாட்டர் மட்டுமே குடிச்சிட்டு இருக்கும் போது 90 kilometers சைக்கிளிங் பண்ணிட்டு ஹாப்பியா வந்திருக்காரு. So sir is also doing his resistance training, exercising regularly from 2018. We are looking forward to see your wonderful session on intermittent fasting, sir.
First, I have to make a disclaimer that am I audible, sir?
Yes, sir. You're audible, sir. You're audible.
Yeah. First of all, I'd like to thank Tamil Nadu State Branch, President Dr. Abdul Hasan, Secretary Dr. Karthik, Finance Secretary Dr. Gauri Shankar, and immediate past President, Teacher President-elects, and Dr. Arun Kumar, Chairman, Tamil Nadu Wellness Committee, and Dr. Pradeep for anchoring this. I would say that fasting is not for everyone, and it is not for every problem. It is not a substitute for a medical treatment. It is one of the tools for a healthy life. And I have to make some warnings. These people should not fast, especially pregnant and lactating mothers and children under the age of 18, and those who are underweight, and persons with eating disorders, and especially type 1 diabetes. These people can do or try fasting, intermittent fasting, with the supervision of and help of the doctor. Those are with type 2 diabetes and persons taking medical treatment for multiple diseases, and psychiatric patients and very old people. What is fasting? The doctor was telling, Dr. Farooq was telling that it's a carb addiction. I would say we are all food addicted. So, in my personal opinion, fasting is a cognitive behavioral therapy for a food addiction. There are a number of types of fasting available. Broadly, we can classify into two. One is extended prolonged fasting, which Dr. Pradeep was telling me that telling us that I did 303 hours. That's a prolonged extended fasting. It is not for everyone. And another classification, intermittent fasting. Today, we are not going to talk about prolonged fasting. We are going to stick to only intermittent fasting. If you do a Google search for your intermittent fasting, you will get this of a lot of diets will come.
Sorry to interrupt you, sir. Can you just switch off your video, sir? Konjo voice interrupt agudhu. Signal issues nenikiren.
Okay, sir. No problem. Okay, 1 minute. Sir. Okay, sir.
Yes, sir. Thank you.
Okay, sir. Now.
Thank you, sir. Thank you, sir. Please go on, sir. Please go on.
Yeah. If you look at the journals, literature, intermittent fasting can be subdivided as 3 types. One is alternate day fasting. In that, we do a fasting one day and then eat normally other day. Right? We take a very low calorie on the fasting day. So we have to keep alternating fasting and eating. This is alternate day fasting. Second one is a 5-2 intermittent fasting. In this, we take a food 5 days a week, and 2 days a week you have a low calorie, somewhere around 500, 600 calories, not on a 2 consecutive days. It will be separated by 2 days gap. This is called the 5-2 intermittent fasting. Another one is time restricted eating. Today, we'll be talking more about time restricted eating. And in this, the famous intermittent fasting or time restricted eating is 16-8. In that, you do a fasting for 16 hours and eat for 8 hours. Can be 12 to 8 or 11 to 7 or 8 to 6, whatever the time you are comfortable, you can do with the 8 hours of eating. And if you say intermittent fasting, you all have a fear that fasting will produce a lot of problems. And in scientific terminology, we can make it as a time restricted eating because it looks like a little jargon that nobody can understand. Instead of even that, if you say intermittent eating, people love it. One of my friend told in a WhatsApp group that instead of saying intermittent fasting, if you say intermittent eating, everybody will follow. So we can say either time restricted eating or intermittent eating. So once you know the eating, what is the definition of eating? Any calorie or any nutrient which can affect the neuroendocrine, neurochemicals like dopamine or serotonin, or endocrine like insulin or leptin, or any metabolic factors, glucose, ketones, which is associated with the state of fasting. So if you break the fast, that's called the eating. What is time restricted eating? So I told earlier it's a CBT, like behavioral intervention based on the circadian rhythm. And you restrict your food intake to certain period of time, say about 8 to 10 hours. How can I start? Because this is the sample prescription for a person who start the thing. It is recommended by the New England Journal of Medicine, 2019 article. So in this, anyone can start a 10 hours feeding window, 5 days a week or 7 days a week. Why 10 hours of time restricted eating? Multiple trials I've done with the 10 hours of eating window have shown same comparable benefits compared to the other smaller windows like 6 to 8 hours. So even 10 hours of eating window is more than sufficient to get the food benefits of intermittent fasting, not time restricted eating. In this 10 hours of eating, this is called a 14-10 diet. You have to fast for 14 hours to eat for 10 hours. I did a small survey before this presentation. Out of 80 responses, 67% they said they have tried intermittent fasting. And out of 70 responses, 60% people are not able to continue the intermittent fasting. Then I thought, how can I make it a lifestyle incorporation to a busy people like doctors? So if you do a LCHF diet, low carb healthy fat diet, like Dr. Farooq said, it's easy because you'll have more satiation with the protein and fat. So you need not to struggle about it. If you do a proper LCHF diet, it's an easy way to start a intermittent fasting. But someone doesn't believe that this thing or very hesitant to start, but still they are asking, can I start intermittent fasting with the normal South Indian meal like this? It may be a little challenging, but if you do a little planning, you can do it well. Okay. So now the plan number 1, dry fasting. It is not that regular dry fasting, it's a nighttime dry fasting. It is nothing but a during sleep hours, don't eat or drink calories. Normally, in the midnight, we get up and then go to the restroom and then go to the fridge and then drink something or eat something out of boredom or not getting sleep. So don't do that. It's very simple and easy. You have to follow it. If possible, don't try to drink water also. You can sip of water. This is called a 7 to 8 hours dry fasting and during the night sleep time. Plan number 2 is a mini fasting. It's done in the daytime. What is it? In this mini fasting, we are trying to achieve 3 meals a day. Dr. Farooq said that we are eating 6 meals a day, like tea, breakfast, then tea, bonda vadai, and then lunch, and then snacks, and then night dinner, and then night or 6 or 7 times. So if you keep on eating, as we saw in the slides, the insulin will be always high. So in this mini fasting, your idea or goal is to eat only 3 meals a day. This is the goal. How to achieve this goal? Not eating in between meals. So first you start with stop eating mid-morning snacks. Say about 11 o'clock, whatever you are eating, you just try to avoid. And evening snacks and beverages like tea, coffee, you try to avoid. And then you change the early morning coffee or tea with a milk or sugar to a black tea or black coffee like non-caloric drink before breakfast. Suppose if you are getting hungry in between the meals, what you can do as alternative, you can take lemon salt water. Say about 11 o'clock, you feel hungry. If you take lemon salt water, definitely you feel much better. Initially, it may be difficult, but if once you get trained, you'll be able to do it. Or you can take any clear veg or non-veg food, maybe little calories, doesn't matter. Black coffee or green tea, whatever it is you are comfortable, you can keep doing it. And plan number 3 is evening rituals. This is very, very important. Most of the time, we fail here. We'll be busy in the whole day and then we may not eat also some days. But once we come home in the evening, we eat a lot of junk foods, and then watch TV, and then whatever, and looking at the WhatsApp or YouTube or Facebook, and then eating without our knowledge, more calories, and eating all refined carbs, everything. So, in my personal opinion, this is a very, very important evening ritual. I call this as a 123 rule. Rule number 1. In this, no screen 1 hour before bed. Everybody knows it. Just alternate for this. You can, all these choices you can try. And then rule number 2 is 2 hours before bedtime, no liquid calories. You have a habit of drinking milk or something before bedtime, you finish it 2 hours before that. If possible, even don't even take any liquid or even water also 2 hours before the bedtime. And preferably avoid bright lights. You can have any dim lights in your environment before bedtime. That will enhance your sleep. Third and most important rule is early dinner. So you try to finish your dinner at least 2 to 3 hours before your bedtime. Why? Because as the clock setting in the evening, after the sunset, because of the darkness, your melatonin will increase. This melatonin will prepare you for sleep. And this increase in melatonin body will inhibit the secretion. So when you eat in the late night, you may develop a glycemic dysregulation that may lead on to a next day problem in the impaired glucose tolerance also. So you try to finish your dinner 2 to 3 hours earlier to the bedtime. சார் நீங்க சொல்லிட்டீங்க என்ன சார் நீங்க வந்துட்டு 3 மணி நேரத்துக்கு முன்னாடி சாப்பிடுங்கன்னு சொல்லிட்டீங்க. ஆனா சாயங்காலம் 7 மணிக்கு 10 மணிக்கு எனக்கு இவ்வளவு பிஸி ஓபிடி இருக்கு சார், எப்படி சார் நான் போய் சாப்பிடுறது அப்படின்னு கேக்குறீங்க. அதுதான் எல்லாரோட முக்கியமான கேள்வியுமே. அதுக்கு என்ன பண்ணலாம்னா, நீங்க வந்துட்டு ஒரு டின்னர் பிரேக்னு விட்டுருங்க. இப்போ லஞ்ச் பிரேக் போற மாதிரி டின்னர் பிரேக் விட்டுருங்க. அந்த டின்னர் பிரேக்ல உங்களோட டைம் டு ஈட்னு நீங்க டிசைட் பண்ணிக்கோங்க. உங்க ஸ்டாஃப் கிட்டையும் பேசுன்னு சொல்லுங்க, இது டின்னர் பிரேக்னு சொல்லுங்க. அதுக்கப்புறமேலு சார் டின்னர் பிரேக் சரி, வீடு வந்து 2 கிலோமீட்டர் தள்ளி இருக்குது, நான் எப்படி சார் வீட்டுக்கு போயிட்டு வர முடியுங்க சார் அந்த 3 நேரம் 1 நேரம் கேட்டீங்க. அதுக்கு என்ன பண்ணலாம்னா, நீங்க டின்னர் பாக்ஸ் எடுத்துட்டு போயிடலாம். ஈவினிங் கிளினிக் கிளம்பும்போதே you can take something like a lunch box, you can take some dinner box, and then you can have your dinner break around 3 hours before your bedtime, and then you can finish your OP 1 hour before your bedtime, and then you can go home, and then you can do your other last hour rituals, and then you can go to the bed. So this is how you can manage your early dinner. Fourth plan is morning rituals. Yes, most of us will be doing it, but still I'm re-emphasizing here. As soon as you get up, have hydration, you can do any kind of meditation or yoga, physical activity, exercise. And the important thing is, if you can avoid caloric drink like coffee with a milk or tea, and then you can change it to a black tea, black coffee, or green tea, like non-caloric drink, and then postpone the breakfast 3 hours from the wake-up time. This is the important rituals you have to learn regarding the time restricted eating. Now, இந்த மாதிரி இந்த ஒரு 4 பிளான் நீங்க வந்து இம்ப்ளிமெண்ட் பண்ணினா டெஃபினட்டா உங்களால இந்த டைம் ரெஸ்ட்ரிக்டட் ஈட்டிங் 10 ஹவர்ஸ்க்குள்ள பண்ண முடியும். அண்ட் இந்த 10 ஹவர்ஸ்ல டைம் ரெஸ்ட்ரிக்டட் ஈட்டிங் நீங்க பண்ணாலே மேக்ஸிமம் பெனிஃபிட்ஸ் கிடைக்கும். ஈவன் திஸ் கேன் பி டன் வித் த நார்மல் டயட், பட் இட் நீட்ஸ் லிட்டில் பிட் ஆஃப் பெர்சிவரன்ஸ் அண்ட் ட்ரைனிங். நீங்க ஈஸியா சொல்லிட்டீங்க சார், எப்படி சார் இந்த 10 ஹவர்ஸ்க்கு 4 பிளான் பண்ணா வரும் அப்படின்னு கேட்டீங்கன்னா, sleep 8 hours, the must. Evening ritual 3 hours, morning 3 hours, total 14 hours. So you got a 10 hours of eating window. In this 10 hours of eating window, you'll be doing only 3 meals. So what happens during your time restricted eating? First 3 hours, 3 to 4 hours, you are in the still you're in the fed state only, not in the fasting state. So everyone knows that insulin increases and then insulin puts a glucose into the cell and glycogen forming and fat forming, all that's happening. Actually, after these 3 hours, if you again eat, the same thing is going to happen. So your insulin will be keep stable and up throughout the day. This is what Dr. Farooq said, carbohydrate insulin model. You have to reduce your insulin. One way is doing a reducing the carbohydrate and increasing the fat. But another one is don't eat after 3 hours. That's what I said for mini fasting. So only 3 meals a day. And then if you continue to not eat after 3 hours, these things will happen because blood glucose will come down, but you will get hypoglycemia. The person is normal. Diabetic patient, okay, because of medication, they'll get hypoglycemia. For a normal person, don't fear of getting a hypoglycemia because once your glucose is down, your insulin also will be down and the glucose will up. And then your liver glycogen will start giving you glucose for energy. And even if that energy is exhausted for, say, about 20-24 hours, fat will start mobilizing and then that will give the energy for your body. Of course, if you feel hungry at 3 hours or 4 hours, you can take some lemon salt water or some black tea, green tea. Then you can try some meditation or relax walking. All that will help to overcome the hunger. Because we think the hunger is the biggest problem, not able to do the fasting. In Berlin is the hunger hormone. The once you are hungry, the ghrelin starts increasing and it's not keep on going. After some time, it will come down. You must have experienced that சில நாள்லாம் வந்து நம்ம தியேட்டர்ல ரொம்ப பிஸியா இருக்கிறோம், ஓபிடி பிஸியா இருக்கிறோம், ஒரு லஞ்ச் நம்ம சாப்பிட லேட் ஆயிடுச்சுன்னா அப்புறமேல் கொஞ்ச நேரம் பசிக்கும், அப்புறமேல் பசிக்காது, அப்புறம் ஈவினிங் தான் பசிக்கும் நமக்கு. அதனால டோன்ட் worry about the hunger, just keep continuing and don't worry about the glucose. Your liver will build up glucose and அப்பப்போ லிவர்ல இருக்கிற கிளைக்கோஜனை வந்து நீங்க டிஸ்சார்ஜ் பண்ணணும். சாப்பிடும்போது நீங்க ரீசார்ஜ் பண்ணணும். பேட்டரி மாதிரி தான். டிஸ்சார்ஜ் ரீசார்ஜ் பண்ணாம கண்டினியூஸா அதை வந்து ரீசார்ஜே பண்ணிக்கிட்டு இருந்தீங்கன்னா ஒரு நாளைக்கு லிவர் வெடிச்சு போயிடும். அதுதான் ஃபேட்டி லிவர் அந்த மாதிரி நடக்கிறது, ஸ்ட்ரெஸ் வர்றது. செல்லுலர் லெவல்ல அல்லது வந்து இந்த ஃப்ரீ ஃபேட்டி ஆசிட் வந்த பிறகு எப்படி நடக்குதுன்னா, ட்ரைக்ளிசரைட் ஃபேட்ல இருந்து இன்சுலின் லோவா இருக்கும்போது தான் ஃபேட்ல இருந்து ட்ரைக்ளிசரைட்ல இருந்து ஃப்ரீ ஃபேட்டி ஆசிட் வரும், கிளிசரால் வரும். கிளிசரால் will go to the liver and that will make some glucose. That will take care of the basal glucose level. And free fatty acid வந்துட்டு லிவர்ல போயிட்டு ketones ப்ரொடியூஸ் பண்ணும். The ketones and free fatty acids will be fueling the muscle, heart, brain and all other organs. Actually, if you do it on a regular basis, in the reduced mTOR pathway nala, you will have an improved performance and more stress resistance will be there. ஏன்னா வந்துட்டு இந்த டைம் ரெஸ்ட்ரிக்ட் ஈட்டிங் பண்ணணும் அப்படின்னு கேட்டீங்கன்னா, it is definitely it's a beneficial to reduce the weight and improvement in cardiometabolic state. As I said earlier, the liver, fatty liver will be reduced. It will improve quality of sleep and the quality of life. At cellular level, as Dr. Farooq was telling that you have to have ketones and nutritional ketosis and glucose. So this is what about that metabolic flexibility. When you are in a fasting state, your body will use ketones as a fuel. The moment you start eating, the body will try to use glucose. From ketones, it will switch over to glucose. Because of the ketones, all these activities will be happening. Because of the glucose, these activities will be happening. So if you do it in a long run, you will get adapted to that on a regular basis. If you get adapted to that, this ketone fat adaptation, you'll have an increased insulin sensitivity and then increased heart rate variability and lipid metabolism will be improved. Your gut microbiome will be healthy. You will definitely reduce your abdominal fat, inflammation, and blood pressure. And because of these factors, you will have a more resilience and more disease resistance. It's a relevance for all these flights in a humans. there is one review article in 2022 endocrine reviews. In that, they have time restricted eating for and prevention for the management of metabolic diseases. They have taken 39 studies in this review, and out of 39 studies, 30 studies are done with the 8 to 10 hours of eating window. I told you earlier, 10 hours is more than sufficient to get the maximum health benefits. And in this, most of the studies are only short-term studies, only 12-week studies, not more than that. It's one of the limitations of this all time restricted eating study, clinical trials. In these studies, 18 studies have dealt only with the overweight obese people. 7 studies done with the normal healthy adults. Even normal healthy adults can do a time restricted eating, not only the obese people. And 5 studies are done even with athletes. Even the athletes can incorporate intermittent fasting in the lifestyle. And older population, 2 studies are there. It is possible. With the cardiometabolic diseases, metabolic syndrome, all the problems, 4 studies are available. What is the results of all these 39 studies put together? Definitely, there is a weight reduction in BMI. Again, fat percentage reduced, weight circumference reduced. And smaller group of studies, it has shown that inadvertent energy reduction. Need not to count the calories. If you do a time restricted eating, definitely your calories will be reduced. It's one of the mechanisms is time restricted eating is beneficial to the patients. And in 12 studies regarding the glucose metabolism, definitely the fasting blood sugar is reduced, glucose area under curve is reduced, increased insulin sensitivity in beta cell function. Limitations of studies, as I told earlier, small sample size and short term, and mostly are done with men and only not many of RCTs available. When you do this fasting or time restricted eating, we have some mistakes. We start with the wrong interval. So straight away, in the meeting பார்த்துட்டு நாளைக்கே போயிட்டு alternate day fasting கொடுத்துட்டு அதுக்காக தான் I am only talking about time restricted eating only 10 hours. Don't do anything, start big and then end up with a problem. You start slow, steady, slowly, gradually progress. And some people, they try to eat more in the eating window because they are not eating for 14 hours. They think they have to compensate in the not eating period in the eating window. It's not like that. Whatever possible, you eat according to your hunger level. And then some people try to follow the rigid 10 hours eating window only on a daily basis. It will be very difficult for a day-to-day life. Even all the study says you have to have a consistent window at the same time interval. Then only you will be able to get the benefit. But in real life, it is difficult. So one day it can be 8 hours, one day it can be 10 hours, one day even you can go with 12 hours. No problem. It is flexible. And breaking the fast with the wrong food. Don't break the fast with the high carb, refined carbs food. You try to break the fast with the vitamin, mineral rich, protein dense food or with the some fat food. Don't with the lot of carbs because that will spike the insulin suddenly. That will have a lot of problem. And most of the time during eating window, people are taking poor protein and less fiber. So you have to have proper protein to avoid cravings or hunger during the fasting window. And many people don't hydrate during the fasting window. Fasting and diabetes, there are 3 studies recommended in the ADA report, 18 to 20 hours, and no improvement in HbA1c. So it's not a very good strategy to control the diabetes. Only one study says there's reduction in HbA1c. So for type 2 diabetes, it may not be a treatment protocol. And but in a pre-diabetes, early time restricted feeding. Suppose like you skip the evening dinner and morning breakfast and lunch, late lunch. That's called the early feeding, restricted feeding. In that, definitely there is a beta cell function is improved and blood pressure and oxygen is reduced. And so the pre-diabetes are getting benefited with this. And in type 2 diabetes, as I told earlier, not significant effect in HbA1c, but it is feasible, but it's not a good treatment strategy for a type 2 diabetes. And in diabetics, in the obese diabetes, weight reduction will help, and pre-diabetic glycemic control will be there. Type 2 diabetes can be tried with the supervision. And what about exercise and fasting? They run a study. In that study, 8 hours of time restricted eating daily, 8 weeks. In that group, resistant training people daily In that group, they have done all measurements and fat mass is reduced and fat-free mass is maintained, lean mass is maintained. There is no loss in muscle. Most of the people, they say intermittent fasting will produce muscle loss, but it's not so in intermittent fasting. Especially it is combined with the resistant training and proper protein intake. But extended fasting, definitely there will be a muscle loss will be there. Don't do that. In another study is there available. It's a randomized RCT control. In this, they've seen lean mass is gained little bit, but they done a 4 hours of time eating, 4 days only. And in regarding exercise, we can do a weight training in faster state also, no problem. Both weight training, cardio, and physical activity all can be done in a faster state. One word about the woman is different from men. Yes, because of their menstrual cycle, they have to have a little bit different strategy. Initial 10 days of their menstrual cycle is dominant, so they can go with the 8 hours of eating. That is 14 hours of fasting they can do comfortably, no problem. But towards the end of the menstrual cycle, definitely they have a problem. They'll be craving for carbs and sweet, sugary foods. So don't try that same 14 hours of fasting, say about in the closer to the end of the cycle. So you reduce gradually. First 10 days, maybe 8 hours. Next 10 days, maybe 10 hours. Towards the end of the cycle, closing the cycle, you go for 12 hours. You can just change according to your menstrual cycle. Okay. In conclusion, keep it simple and stupid. Simplicity will increase the effectiveness. For keeping it simple, I just propose a 3-square rule. That is, postpone the breakfast 3 hours from the wake up. Prepone the dinner 3 hours before bedtime. Only 3 meals. With these 3 golden rules, I'm concluding my talk. Thank you very much once again for the IMA Tamil Nadu branch.
தேங்க்யூ ஸோ மச் சார். ஸோ ஃபாஸ்டிங்ல வந்து இவ்வளோ விஷயம் இருக்கு அப்படிங்கிறது இன்னைக்கு தான் நானே தெரிஞ்சுக்கிட்டேன். மினி டிஃபன் மினி இட்லி மாதிரி மினி ஃபாஸ்டிங்ல ஸ்டார்ட் பண்ணி டைம் ரெஸ்ட்ரிக்டட் ஈட்டிங் வரைக்கும் என்ன ஃபாஸ்டிங் மிஸ்டேக்ஸ் அவாய்ட் பண்ணணும்னு எல்லாமே கவர் பண்ணிட்டீங்க சார். அண்ட் ஐ திங்க் யுவர் கோல் இஸ் டு மேக் everybody inspire everybody to practice some form of fasting in their routine lifestyle. ஸோ கண்டிப்பா வந்து இங்க இருக்க எல்லாருமே we are inspired சார், and we'll take it up in our own lives. So 2 queries வந்திருக்கு. Both are similar. One is about breaking the fast with sugar or fruits. Similar, something they are asking about that. After intermittent fasting, can we take sugar or fruits? They are asking, sir.
No, it's not to take fruits or sugar because that will increase your insulin immediately. If you increase your insulin, definitely you are going to crash down once again. And it is like giving insulin to a type 1 diabetes insulin deficient, diabetic ketosis level. If you give insulin, you'll have a lot of electrolyte imbalance will be there because potassium shifting from intracellular to extracellular. So the same thing will happen in this also because you're in a fasted state, you're not taking any food, your insulin is low. You suddenly spike your insulin with the sugar or fruits. Both are going to increase your sugar suddenly. It's not advisable. That's why I said breaking the fast in a wrong method. You have to break your fast with, say, about bone broth or vegetable soup, vegetable broth, or any soup because it has a lot of minerals and vitamins. If not possible, you can take with the protein, either egg or some meat. That's better. So don't do with the carbs, especially with the sugar and fruits.